I think our mouth is such a private part of our body, you know. So when we allow someone into that space, I think you naturally become close to that person because you've allowed them into a very private space of yours.
Can you tell when a patient has come in and has performed oral sex? They say dentists can see that.
Yes.
Really?
Okay, hold on. Let me clarify.
Look at my feet.
Welcome to another episode of 80/20. Today, Shanina and I have a very dear friend of ours, Dr. Ellie Farahmand, with us. She's an entrepreneur, she's a dentist, she's a cosmetic injector, she's a content creator, she's a super mum. What is it you don't do, Ellie? Welcome to the show.
Thank you so much. Thanks for having me here. I'm honored to be with you guys. Not only have become amazing friends of mine, but we started out as a patient doctor, but I feel like I'm like one of the girls. So
you definitely are one of the girls. We love everything about you. I was just saying when I walked in before, I was like, man, she never misses. Like anytime I see you.
I have to stand next to you guys, so I had to try really hard.
Oh gosh, please. You're like, this is a dentist. Like, wow.
I know. Whenever we walk into Ellie's practice in Santa Monica, which is Santa Monica Dental Studio, you're greeted first of all by Pablo, the famous Pablo.
Poppers, yes.
I had the best moment with Pablo when I walked into your surgery one day, and he literally jumped on the front desk and jumped over the desk to greet me, and it was just the best thing ever.
He loves Georgia. He loves Shanina too. He knows who's a dog lover.
Yeah. He's really great energy when you walk in and you have like the really nice, beautiful custom scented candles.
That's right.
Yeah.
I know. And I think I went in there, I was just pregnant. I think I told you I was pregnant. And I was supposed to come see you and I was sick.
That's right.
And you guessed it. She's like, she's pregnant. And obviously I was very, very early, and Pablo jumped on the chair with me and lay down on top of me. And she was like, oh my God, he's never, ever done that before.
Yeah.
He's like,
he sensed it.
He sensed it. It was a very beautiful, sweet.
I know. I think
moment.
I have pictures and videos of that.
He was just
so
he
sweet.
wouldn't leave.
No, he was just laying on top of her. It was so sweet.
Aww.
I
know.
Oh, he's the best boy.
Pablo was the best thing I ever did, really.
Yeah.
One of my
that
best
way.
decisions.
Yeah.
And the patients love him. It's funny, the girls always laugh. They say, Dr. Ellie, when patients call to confirm their appointments, one of their questions is always, is Pablo going to be there?
Yeah.
It's true, because it's such a perk going to the dentist, and a lot of people hate going to the dentist, don't they? Because it can mean injections, it can mean pain, whatever.
I promise you, nobody likes going to the dentist.
Right. But I mean, I honestly feel like having Pablo there, it makes you, and of course coming to see you, it makes you look forward to your appointment.
He does. He really, and that's one of the reasons why I actually got him. My kids had been begging me for a dog for months and months, and it was COVID, and we were all sitting at home, and I was like kind of in the works of taking over the practice that I now currently have. And my son said, we're all home, we can help take care of the dog. And everything just happened. My cousin called me, said that there was a dog available. That was the kind of breed I wanted, because I wanted it to be a hypoallergenic dog, and I knew that they were really sweet. And I just made the decision in 5 minutes. I said, he'll be great to bring to the office. It'll be different. Patients will feel a little bit better, and he really has just been amazing.
You think he brings a sense of like calm to your patients?
100%.
Yeah.
100%. The other day, I had a patient in the morning. It was 8 a.m, and she came in, and she was crying. She had like a personal issue going on, and she was sitting in the lobby, and I saw her, she had tears coming down her face. So I went around and I went to the lobby, and I was sitting with her. I brought her like some Kleenex and some water. He came over, and he didn't know her. It was the first time he had met her. He started kissing her and rubbing himself all over her and just like being silly with her. And she was like, she stopped crying. She said, oh my God, how did he know? Their dogs are amazing.
Yeah.
They really are.
Yeah, he knew she needed a little bit of love. So
Honestly, I don't know what I would do without my dog.
I know.
I got her 4.5 years ago when I was going through a period of serious burnout in my DJ career. And I thought to myself, this is absolutely insane with a touring career getting a dog. But it was something that I just felt I really needed. And it just kind of worked out. I don't know how. I just sort of, I manifested this beautiful dog that, little ginger girl, that travels everywhere with me, and she just sleeps in plane seats, and I put her, in hotel rooms, and she doesn't make any noise. She just watches TV and naps on the bed.
Wow, that's pretty.
And she literally is my little roadie now. She comes everywhere with me.
Yeah,
So
my twins, my two younger kids, just left for college. We were talking about it, and I think, well, what if I didn't have Pablo? What would I do at night?
yeah, no, really.
Who would I nurture and care for?
I know, he's my baby.
Yeah.
I want to talk about you being a businesswoman and having 4 kids. How do you do it? And also the owner of your business, and being all women at your practice. You want to talk about that?
Sure, that's a great topic. So I worked as an associate in the practice that I own now for 24 years. I didn't even have kids at that time. And I didn't want to have my own practice. I wanted to work, but I wanted to be a mom. I wanted to be involved with her in their life. And this practice was close to my house. It felt like home. I loved the doctor that I was working for. I loved the staff. And it was easy. It was convenient. If I needed to go to school to watch my sons play, I was able to go. I was able to run there and come back. So it was just very convenient. So 24 years passed. I worked part-time. I had 4 kids. I was involved in their school. I was involved in all of their sports. I was able to come and go. I did have a very supportive, family. My mom, my mother-in-law, I had great help at home.
I can imagine you would need that with 4 kids and working.
100%. It really takes a village. It's like a silly thing to say, but it really takes a village.
Yeah.
But I was also the type of person that allowed people to help me. I didn't want to be in... when I knew that my kids were in good hands and everybody was being taken care of, I was able to say goodbye. I was able to come to work. I was able to do my things at work, and then I would go home. So 24 years just passed like that, where I was working part-time. And as I said, COVID hit, and the doctor that I was working with had plans of retiring, but COVID kind of threw things, into like a bit of a, it sped things up for him.
Yeah.
So I said, wow, I've been wanting to own this practice for 24 years, and now in the middle of COVID, I don't even know if we're going to be open tomorrow or not. We didn't know what was happening.
Yeah.
But I said to myself, if you don't do this now, you might not have this opportunity again. You've been here. This is what you've been waiting for.
Your kids are a bit older.
Yeah.
And timing's probably good.
And exactly. And that time my kids were in high school. I knew they were going to be graduating. And I'm not the type of person to sit at home.
Yeah.
So I kind of forecasted my present situation right now. So I decided to buy the practice. I remodeled it. I made it my own, and the staff that came with the practice, we were all women that had worked together for 20-something years.
Wow.
So it was really important for me to keep them, and
So it's pretty much all women when you took it over anyway.
Yes. He was the only man in the practice at that time.
Oh wow!
Wow.
What a stud.
Yeah. But I tell you, the chemistry and the energy in the office, even with one man being there or not being there, it really changes what the environment feels like. Not that it was a bad thing, but it's very different. It's palpable. Patients would notice it. They would come in, long-time patients of ours, and they were the ones that actually pointed out to me. They're like, wow, you could really tell that there's a bunch of women in here running things now.
I think so too. Yeah.
Whether it was the fresh flowers or whether it was, I did some things differently, obviously. The aesthetics of the office was more in tune with my aesthetics. I remodeled. I had a scented candle, I have art, I have flowers, I have, plants.
Yeah, it's gorgeous.
Thank you. It's it's a reflection of me. I mean, first of all, I'm there every single day.
Yeah.
I want my environment to feel good to me. I want my staff to feel good, to be proud.
Yeah.
But it was also important that I really keep my staff as women, and it feels very empowering to be able to have a team of women around you that all strive to achieve the same thing. And when you have that good group, it like nothing is impossible, in my opinion.
Yeah, I love the feeling of it's calming and nurturing when I do come in.
Yeah, I agree.
Yeah, it feels like you can just be nurtured really well, and you can tell like
A lot of us are moms.
Yeah.
A lot of us kind of have
Yes.
Absolutely.
And very
It's really
clean. Always super clean. Like, I mean,
I would hope so.
Well, you would hope so, but I have been to plenty of doctors' offices before and other practices where it's not. You walk in and, there's marks all over the walls and the furniture's kind of old and they just let it go into disrepair because they think, oh, well, it's fine. I'm a great doctor. I do great work. That's all that matters. But it makes a huge difference when you walk into a place and it feels welcoming and nurturing and clean and, inviting.
And all of those things were really important when we were doing the design because, like we said, you don't wake up in the morning and go, oh, hey, I'm so excited to be going to the dentist today.
You're like, ow.
Nobody feels that way.
Yeah.
So I wanted the environment to not feel like you're walking into a dental office. I didn't want it to smell like a dental office. I didn't want the lights to be like hospital lights.
Yeah.
I hate that.
Right?
Yeah.
All those things give you a little bit, increase your anxiety.
They do. Yeah.
So,
I want to know this. Is going to the dentist kind of like going to the hairdressers where you get in the chair and it becomes the chair of truth and you just start spewing your deepest, darkest secrets?
That's actually I've thought about this a lot. That why does it become that way?
Yeah.
And this is my theory. I think our mouth is such a private part of our body. We it's not something that we don't open our mouths for everybody, right? There's a lot of neurons in there. We get a lot of pleasure from eating, other things.
Sexual energy.
I knew Shanina's brain was
I've
going
been
there.
so naughty on this podcast.
Yes. Shanina's like, ooh, yes, mouth, sex, let's go for it. Let's talk about it.
Terrible.
We do have some questions around that, by the way.
We'll get there. So when we allow someone into that space,
Yeah.
I think you naturally become close to that person because you've allowed them into a very private space of yours. And I don't try to pry, but honestly, you become close to those people, and they tell you a lot of things.
I feel like you know everything about me, Ellie. I'm not gonna lie. I mean, we always have to stay on good terms now because otherwise, I'm fucked.
No. First of all, I am the most private person. I mean, if you ask my friends, I don't ever divulge anyone's secrets, but I'm also, I have an oath.
Yeah.
We have HIPAA laws.
Is that true? Yeah, that is very,
Ellie
very
also
true.
knows my whole life story. I think I've overstayed my appointment time.
I love that.
So often. I feel like I go in there and I'm like, yep, cool, in and out in an hour, and three hours later I'm still gossiping with you. It's great.
No, good.
That's why I love my job.
So you don't just do dentistry though, you are also a cosmetic injector, and a damn good one.
Thank you.
Yes.
So I'll backtrack a little bit. So when I was an associate, I love aesthetics. I love cosmetics. I was getting Botox myself. It's something that really interested me. Before I went to dental school, I wanted to become a medical doctor. I wanted to do surgery. These things always were an interest to me. So I actually brought up to the doctor I was working with, I said, hey, what do you think about me going and learning how to do injectables? But he was very conservative.
Yeah.
He was a very conservative guy. And, well, what if you do something wrong? What if, he kind of scared me. And, it was his practice. I couldn't do something that he didn't want me to, so I didn't do it. Fast forward, I took over the practice, and about 6-7 months later, I was talking to my consultant, who happens to be one of my good friends, And I said, I need to do something else. I'm going to burn out with the whole dentistry stuff. She said, why don't you go do injectables? And I'm like, but I can't. I like, what if something goes wrong?
I've been told no.
Yeah, like that, all of that fear came up. And she looked at me, she said, you're a doctor.
Yeah.
You've learned all of this. There's great injectors that are nurses. They're nurse practitioners. They're not doctors, but you're a doctor yourself. What makes you feel like you can't do that? And I said, because kind of makes sense. So,
because someone else created the fear within you to
exactly,
make you think like you can't do it.
Scared me that I wouldn't be good at it. And I did my research. I found somebody that was also a dentist that trains other dentists. And it was a course that I was really comfortable with. It was very hands-on. She was very supportive afterwards. And it's something that I really enjoy. So I think when you enjoy something, you're just going to be good at it.
Yeah.
And I jumped in, and I didn't, I had great support around me. I got a lot of extra training. I am constantly being trained on new things. I think I have a good eye, and I just really enjoy it. And it breaks up the dentistry, so it's win-win.
I really feel like you're great at it. And I noticed that from the moment you started posting that you were doing injectables. Like, you do very, very natural work. What I want to know, I'm really fascinated by injectables. I have had a couple of things done myself, but I feel like there's so many uses for injectables that people may not know about. As far as pain management, you can change the shape of your face. You can change, like, especially with the mouth. Like, there's lots of different things you can do, right, to improve your smile and that sort of thing. What are some of your favorites?
So being able to, before I was doing this, I was kind of limited to, there's only so much you can do with somebody's teeth, right?
Yep.
But when you're able to change or enhance the surrounding features around the mouth, whether it's the lips, whether it's the gummy smile, whether it's the jawline, whether it's, just having more of an alert look, like your whole face changes. So not only am I able to fix somebody's smile, but I'm able to do more of a all-inclusive type of thing where I can really make a difference in somebody's face. So some of my favorites, I love doing lips.
Yep.
Really?
I love lips. I think lips can be very tricky.
There's a lot of duck lips.
There's a
walking around
lot of duck
actually.
lips,
many duck lips.
and it's so funny because now that I do it, that's all I notice.
Yeah, you would, wouldn't you? Just sort of like, oh God, how many mils is in that one?
Exactly. And then also, I just think as a preventative thing, Botox, I think, is amazing. I wish Botox was around when I was 21 years old.
Yep, I started at 21, which I openly tell people because I feel like I do have people comment when they find out I'm in my later 30s. They're like, how does your skin look like that in your late 30s? I'm like, honestly, guys, it's Botox. Like, it is good skincare as well, and I do have a great skincare regimen. I wear sunscreen and all that. But I really think it's because I started at 21, so the wrinkles just didn't come.
I disagree.
You disagree?
I disagree with doing Botox at 21.
Why?
It is a preventative, but I understand that, but like the signs of like wrinkles and like stopping your face from the muscular side of it, I think it's like you start doing like later on, because I feel like we don't start seeing that till even like late 30s.
Oh no, mine was happening in my early 20s.
I think it just depends on your skin.
Yeah.
You are blessed with like the most gorgeous skin. Okay.
I had an eyebrow raising, like this one would not relax for years. And in my photos, I was like, this is really frustrating. I'm seeing it. But to the preventative, I just feel like the injectable side, from my personal thing, I don't think women or even men should start doing injectables until like 25 and after.
I think it just all depends.
Yeah.
Really, I mean, I have 25-year-olds. I have some 21-year-olds that we call it baby Botox. I think that the really important thing to note is that you don't overdo anything.
Yeah.
Yes.
I'm very, 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 like, I try to dose as minimal as possible.
Yeah,
I don't, first of all, I don't like the look. I don't like the frozen look. Even in my own face, I like to have movement.
It's uncomfortable. Have
It's
you ever been over Botox before? I have.
Yes.
And it feels like your brow is
It's dropping
down. It's like
Yeah.
heavy.
Yes. It doesn't
it was
feel good.
awful.
So I always like to go minimal, and so that you don't get that frozen look. But, you know, thinking about myself, when I was working, I was always frowning. So I had those nasty 11 lines.
Yeah.
Even in my 20s, I had them.
Yeah.
Just because of my facial expression. So I wouldn't say no to it. There's people that I have said no to. They come in and they want this done, that done, and I really try to explain to them why it's not a good idea. I always like to do minimal things.
And
So-
is it true Botox should only be done from like here up? But also I understand that sometimes the jawline
masseter is huge.
And
Yeah, I've
what
had
does
it on
that
my
help?
neck.
It's for grinding of teeth, isn't it?
Yes. So if you're a clencher or grinder, you're
Yeah.
basically utilizing this masseter muscle that runs vertically from your maxilla to your mandible. And it's just like any other muscle in our body. I always tell patients, you know, I can feel how strong it is. It's almost like you're taking this muscle to Equinox every day and doing a bunch of weights with it. It's
Yeah.
going to grow in size. It's going to become stronger. So what does Botox do? It just relaxes it. It doesn't allow it to be contracting all the time. So it's just weakening it. And along with that, there's the benefit of slimming your jawline. I mean, there's like a whole lot. If somebody comes in and just says, well, I just want to slim my jawline, you know, I really don't jump into doing something like that. There really needs to be a need for it. If there's like headaches, if they're clencher and grinders, if they wear a night guard, but they're still clenching and grinding during the day. She's a big one.
Yeah. I actually started getting masseter Botox a few years ago. And it was funny because I had a lot of people, well, not a lot, but a few people say to me, hey, did you get some work done? Because I had a really square jaw for such a long time. And then when I started getting the muscles knocked out, it really slimmed down my face and I looked totally different.
Yeah.
Which wasn't my intention. It was just a byproduct. But
So yeah, it's a, you know, for some people they love that. But to answer your question, Botox is used for a lot of different things.
Yeah.
And it's not just, you can use it in the neck.
What's for the neck?
So as you age and the thinner you are, you start to get these, we call them platysmal bands.
Okay.
They're like these bands that run down and you get some horizontal lines too. So
Yeah.
basically we inject into the platysmal bands to relax it and it just kind of smooths out the neck.
it's good for tech neck. They call it tech neck from
neck.
us all like staring
I
at
have
our
a bit of
phones,
technique
right?
then. I
Correct.
definitely
Yeah.
have it.
Correct.
I've noticed my back now, I'm like, I have to be upright and this goes away.
Yeah.
Because I keep doing this.
'Cause
And I'm
you're
also
not-
the baby. And
I've got the perfect gift for you. Have you seen those glasses that I wear? Like the ones that when I'm being a degenerate watching TV in
absolutely
bed?
not. I've seen this.
Tell me, what is it?
Okay,
It's
these
terrible.
I'm definitely buying you a pair now. There's these glasses that I wear that allow me to like lie on my back and watch TV because they've got mirrors that reflect.
Oh my gosh, you're
Yeah.
so funny.
Okay, you're both getting a pair now.
Yeah. So between that and your night guard,
Yeah, she's a gem.
I'm a gem. I've got, the silk hair scarf on, the blue light glasses, the night guard, the eye patches, breathe right strip. What else do you need?
That's a self-care at its finest.
Yeah.
Just walking.
I love it.
No,
Yeah.
these glasses look like, it's like some cartoon character. It's not cute.
Yeah. I don't really wear them to be cute, to be fair.
No, I don't think my partner's going to be like, you look hot tonight, baby. Let me get
let me get my glasses out. Let me get my night guard and glasses
I
out.
was like,
Yeah. Yeah.
and also, I've had girlfriends use Botox to reduce sweat production.
Correct.
That helps.
And
And
it can be used in sweat glands, like under the armpits, in the palm of the hands.
palm of the hands as well. Doesn't that hurt? Ooh,
Not really. I mean,
Yes.
it's a needle.
it's a very,
It hurts.
it's an insulin needle. It's really thin. It really doesn't. There's some areas that are going to be a little bit more painful than
A little
others.
stingy.
And does sweat travel somewhere else though?
Good question. Probably.
Because
I mean, your body sweats. You
Yeah.
don't just sweat in your hands. But there's some glands
if it
that are a
stops
little bit
there,
more.
will it go somewhere else? It's like, well,
Possibly.
we have to,
Possibly. Good question. I
Has to
don't know.
come
that.
out somewhere.
I don't do it for the palm, so I don't know.
Yeah. I know girlfriends have done it in the armpits.
Recently, the trap muscle, they call it Barbie Botox.
Wait, I want that.
No, I
This
need
is-
that.
Oh.
I've been on here on the pod, and they'll probably see this later. I'm in so much pain. I've been to the chiropractor, and I have really bad
Yeah.
trap muscles. And with also, again, I didn't realize with the
We're
baby, we're
constantly
constantly like that,
hunching.
and I'm like had to my whole year I've been like this.
I know my work, I'm constantly like this.
Hunched over.
Yeah.
Yeah. No, I've
So,
learned
yeah,
to do this.
They do this, and this term of Barbie Botox has been coined because Barbie has, Barbie kind of looks like this, and it's like a marketing thing. To be honest with you, I think it's kind of
Why
genius.
is it called Barbie Botox if it's in your traps?
Because Barbie has a very slim, neckline. There's no.
Oh, it's
It
just
has
very
to do-
like
yes. So they've coined that term.
very elegant.
It's funny
Appearance.
because the new Barbie is not about looking ideal or looking like a Barbie. It's just kind of
Yeah.
Yeah, but we all love the OG Barbie, let's
we
be
do.
honest.
We do.
Okay, so I want to ask you a little bit more about cosmetic dentistry. Now, I've noticed there's a huge trend, because veneers are obviously expensive, right? So I've noticed there's a huge trend of people going to Mexico, going to Colombia. All these different places
Have you
to
seen
get...
my TikToks about the turkey veneers?
Well,
No.
yeah.
Everyone getting on the plane.
Yeah, and they just basically look like they've got Crest white strips stuck to their gums. And I mean, a lot of people are
scary.
doing it. I can't believe how many of my girlfriends come to me. And these are girls that can afford to go to top American doctors. They're like, hey, I'm just going to go to Turkey to get a nose job or get veneers or something like that. And I mean, great if you find a fantastic doctor there.
Correct.
But
It's safe.
you can also find a lot of
Come on,
dodgy
yeah,
people
yeah.
with, that charge not very much money to do this. I mean, what's
What's the red flags?
So I always say, anywhere you want to go, whether it's the United States, whether it's Mexico, whether it's Colombia, or whether it's Turkey, you're going to find great doctors and you're going to find not so great doctors.
Yeah.
Right? There's people here that do, shitty work too. So you always want to do your research. Just because something is cheap doesn't mean you should do it.
It's usually not good. If
It's
it's
usually,
cheap.
but I have to say, I have seen work coming out of those places that are very decent also.
Yeah.
Maybe we tend to see like the nightmare ones more often, but
Yeah. Well, they make the best content.
Yeah.
they
They
do.
do.
They actually do. those videos have done really well on my.
Yeah.
on your algorithm.
Yeah.
Yeah.
So you really want to make sure that you do your research, you see the doctor's work. Yeah. When you do veneers, a lot of it has to do with the lab that's making the product. If it's a good lab, if they're using great products, if you're not just going to the doctor and they're shaving your teeth and a week afterwards you're coming back for the veneers to be seated. No, it doesn't work that way. You need to have a discussion. You need to have a smile design. You need your teeth maybe whitened. You need to go to the lab. The lab needs to, come up with a design with the doctor. It needs to be discussed. It's not just a 1-2 thing. And that's why veneers are expensive.
It's a lot of
Because
work.
it's a lot. It is a lot of work.
I didn't
It
think
is a
about
lot.
it that it was a whole production like that.
yeah,
I
it
thought like,
is.
hey, I want veneers, and probably people going in like, okay, well, it's going to cost you this, and we'll start tomorrow.
Let's start tomorrow.
Wow.
And there is places like that.
I'm sure, yeah.
And that's where, and that's why I try to educate patients, whether it's in the office or whether it's on my Instagram, that there is a whole process. And it does take a while. You want it to take a while. You want it to be good. You want to, for instance, I tell my patients, once we're ready to go and we prepare the teeth and you go into your temporaries, that's kind of like it's like a test run of the final product.
Right.
You're going to be in it for a couple of weeks. I want to see what you look like after you leave here, because when you leave here, your mouth is numb, your smile is crooked, you can't smile properly. I can't really, I can't really see what they look like. So I want to see you back in a few days. I want you to try eating with them. I want your friends to see you, to see what they think. Is is the shape good? Does it fit your face? Is it masculine enough? Is it feminine enough? And that's when we make any adjustments, because we can make adjustments at that time.
I mean, I saw you post this morning about a gentleman that you've been working on. Was it for a year? Like, you had to make major changes there. Something that I didn't realize happened. You changed the width of this man's bite.
Correct.
Wow.
Correct.
That's major. How did
So-
you even do that?
So people that have, going back to the clenching grinding habit, if your
Guilty.
clenching and grinding habit is not checked, if it's not allowed to continue, what are you doing? You're just wearing your teeth down, right? So as your teeth get shorter, the distance, we call this your vertical height. This distance is gonna get smaller. So when we do want to restore your bite, we actually, if it's to a point where we can't restore it naturally, we have to open the bite up, which is what we did with that gentleman.
Wait, for everyone listening, what's the distance? Like, is it its nose to
To chin. So if I was to put a dot on my nose and a dot on my chin and measure this, that would be the vertical dimension, okay?
Yeah.
So once it gets past a certain point, I can't just put crowns or veneers on the front teeth. I actually have to crown all of your teeth, starting in the back. I have to build them up, and I have to make that height back to where your original vertical height was. We have to wait to see if you're comfortable, because now you've spent years at this smushed vertical height, and now you have to get back into being comfortable at your original position. Then we can restore the front teeth. So that's what we did with that.
You're an artiste.
You are an artist, and you know what? It's so great, I think, to learn that there's so many different options out there, because I feel like the smile is the first thing you know. The smile and the eyes are the first two things you notice on
100%.
someone's face, and it makes such a huge difference to people's confidence levels when you have a smile that you're proud of. And, you know, I think a lot of people take that for granted, but it's true.
They do. I don't know if you guys had ever noticed in COVID when we were all in masks. Did you ever think, like, once somebody took their mask off, you're like, oh God,
Yep.
Like,
you're like a different person.
yeah, it's a different person. I had so many of my friends were like, that guy's so hot.
Yeah. And then the
Take off the mask, like, no,
Absolutely.
no, that's
Yeah.
not him. That's not it. No.
Can you
And-
imagine like crooked teeth or somebody that, you know, has a bad odor? Like,
Yeah, it's like the
there's
lights going on
just-
at the nightclub at the end of the night.
It's
And you've been
makes a
making out with
huge
someone at the
difference.
bar.
It does make a huge difference. I know, like, for my process, when I came to you, I was talking about veneers, but I was really reluctant and trying to move away from it because I don't like the idea of the gummy shark look and knowing, like, that's what's underneath.
Yeah, and shaving your teeth down.
Shaving my teeth down because I do believe I have really great teeth.
You do.
You do.
Yeah,
You do.
so I was
they
like,
just needed to be aligned a little bit different.
Yeah.
And I always try to go that route before we do. I'm very conservative.
yeah.
I practice very conservatively.
I'm thinking about doing back braces though.
Why?
Because my Invisalign, I've just, after having a baby, and I don't have time for it. I didn't even see, I didn't know if it was morning,
I know.
lunch,
I know.
or night.
I know. It was a lot.
I have pictures of me, I was like, that I'm not going to share, but wow, I look really cute.
Well, we almost had you.
You had me. I think I literally went to,
I think we had one aligner left.
What?
we had one, yeah, and then
And
I
you gave up?
And then she had the baby.
I had the baby.
And that moves your
And
teeth
she
a lot,
lost me.
right? Like,
I
doesn't
have been actually, I have to go back to it because also with pregnancy, gum disease is really, really bad. And
your teeth move, right?
the teeth move, but also just based on having a baby, like I notice your gums bleed a lot with pregnancy. Why is that, by the way?
So that's hormonal. It's called pregnancy gingivitis. You know, the hormones in your body are, you know, they're changing. They affect your skin, they affect your hair, they affect your mood, you know, all of that. They also affect your gums. And with your gums, unfortunately, it just comes up as your body is trying to fight something. So your gums get very inflamed, they bleed easily, they're painful, they're sensitive. Not everyone is like that, but some people suffer from pregnancy gingivitis, which then you have to, you know, definitely get your teeth cleaned a little bit more often. You have to be really good with your home care. And then once you have the baby and the hormone levels, you know, go back to baseline, all of that
I remember when I first came to you, I had COVID gingivitis.
You did.
COVID gingivitis.
It's a thing, Shanina. My gums started.
COVID has just been.
Yeah, well, because it's an inflammatory disease. So when I first came to see Dr. Ellie, I had bleeding gums for 2 years that didn't stop. They were just so inflamed.
Wait, how do you get COVID gingivitis?
COVID.
COVID. I mean,
Getting COVID.
yeah, it gave me
Yeah.
gingivitis.
Wow.
I mean,
Yeah.
COVID, like as she said, it's an inflammatory, and it affected everybody in a different way. With hers, it was.
Did you have a lot of patients that were coming in with COVID gingivitis, or like, were you shocked, like, or put like
You know what was
aligning something like, okay, something's not right here?
Well, people were just not coming to the dentist because they were scared that I was going to give them COVID.
Yeah.
And it's such a dichotomy. It's like we were sterilizing everything
Yeah.
before COVID, people. We were wearing masks, we were wearing gloves, everything was sterilized, everything was cleaned. It's kind of crazy, but everybody thought that they were going to get COVID when they came to the dentist's office. So, I mean, we had to ramp everything up a little bit more during that time. So people were just not coming in. I still have patients that, what are we, like 2.5 years out? They're just coming back. They're just
Bet their teeth
because
need
of
to
their
clean.
because of their fear. Yeah, it's like we have to get everybody back on track again. So that was one of the things. The other thing was what Georgia just said. There was some people that had a tough bout of COVID, and it did affect their oral health. And then the other big thing, and I actually did a radio interview on this. It was cracked teeth.
Oh, from all the stress.
Yes.
Cracked teeth from stress.
Yeah. So when we were allowed to open back up, we came back. We weren't coming back at like a full schedule, but I was working like maybe a couple of days a week. And I was like, after a month, I'm like, wow, I'm seeing 2-3 patients a day with broken cracked teeth.
Wow.
Wow, that's a lot.
It was a lot. And what I was thinking, I told one of the girls, I said, you guys, I think people are so stressed over COVID that they're just cracking their teeth left and right. A week later, there was an article in the New York Times about this.
No way.
Yeah. It was like a whole phenomenon. And then I had a patient who was, I was actually talking to about this, and he called me like that after the article came out, and he's like, you remember we were talking about that? This article just came out. Can you talk about it on the radio? And it was. People were stressed. They were. A lot of times when I tell people they're clenching their teeth, they don't even know. They don't realize it.
Yeah.
But it was so bad that people knew that they were doing it.
Oh, yeah.
Oh, wow. So it's just all based from the stress and clenching, and it created like
Yes.
brittleness for the teeth.
And it would just break.
Oh, my goodness.
Yeah. Hence why I wear a night guard. I was going to be one of those people, Shanina.
Oh, my gosh. Well, you had the
I'm like,
you had
honestly-
COVID gingivitis, you poor thing.
I had COVID gingivitis. I sleep with a night guard, my blue light glasses, whatever else. I'm a catch, guys.
She's sexy.
Like,
yeah,
sexy,
self-care. At least you're going to the dentist, you're doing the right things.
yeah. I no longer have COVID gingivitis. We did fix it.
We did.
And you also actually, this is another thing, because we all like to be super healthy and, eat as clean as possible. And I tried to extend that to my oral health by using a natural toothpaste. I found out that was kind of not the right thing to do.
You listen to my Instagrams. Wow.
Yeah, no, you
I
told me that
love
in
it.
person. You're
Oh,
like,
okay.
actually, you need fluoride.
You do. I'm a firm believer that fluoride is good. I know there's going to be people out there that are going to be like, it's toxic. But we're adults. We
Yeah.
don't ingest the toothpaste. We spit the toothpaste out. And there's minimal amount. Even if you do swallow a little bit of it, it's not a big deal. Fluoride is needed for your teeth. Fluoride is needed. On a small child, I wouldn't recommend that.
Yeah.
That's not.
I used to like
Yeah,
eat the
because-
go.
Did you weirdo?
I did.
But
Brush my teeth and you
but
just
for
suck it up. You
adults,
didn't do that?
adults, you need fluoride in your toothpaste. You do.
So no to
Tom's,
charcoal.
no to charcoal. Charcoal is too abrasive.
I have
Okay.
charcoal.
Do you?
Yeah.
You brush your teeth with
We're a
that
house of
black.
charcoal.
Too abrasive.
But this one was a Colgate one. I think it's like fluoride mixed with charcoal.
Too abrasive. Go back to regular.
What about peroxide toothpaste? I like to use the hardcore Crest with all the chemicals in it.
You know, I love you.
I do.
Give me all the chemicals.
Yeah, well, because it whitens my teeth, so
That's
I
fine.
like
If you're not sensitive, if you don't have sensitive teeth, that's okay to me. If you were, you know, dealing with sensitivity, I would tell you to stay away from that. But charcoal is too abrasive.
Vanity before sanity.
So I have to tell my household.
Beauty is pain.
Yeah.
I'm going to tell my household today we're getting rid of the
No
charcoal
more
toothpaste.
black toothpaste.
Yeah, it's a little bit gimmicky.
Really?
Oh, so it doesn't even work, you don't think?
Not really. It's just it's too abrasive.
Yeah.
It's too abrasive. You don't want to use anything. I mean, enamel is hard. Enamel is the hardest product in our bodies.
Yeah.
But
we do a good job of wearing it down.
yeah, if you're brushing enough times a day, if you're brushing the proper way, if you're flossing at least once a day, that's all you need.
How long do we have to brush for?
2 minutes.
2 minutes?
Yeah,
I don't
I've
do
been
that.
doing.
I always say when I tell my young patients, I say put on a song. From the beginning to the end of the song is what you should be.
Oh, that's actually a good idea.
Yeah. Just make sure it's not like a Hans Zimmer.
Yeah, not like a 5-minute, you know, extended version.
Yeah.
No, so quick minute songs, because sometimes I'm like, I have 50 seconds or 30 seconds.
Yeah, I'm like, that'll do. Whack in a Listerine strip.
Or you use an electric toothbrush. You know, some of them have timers.
Yeah. So we all should have an electric toothbrush.
I love electric toothbrush because not everybody knows how to brush the proper way.
What's your favorite?
I love the Braun.
Okay.
Yeah.
Braun toothbrush.
I've tried the Sonic Hair. I personally don't like the Sonic action. It's too like, you know.
Yeah.
But some people love it, and if you like it, I just think the Braun is easier to like get used to, and it has a small head, round head. It gets to the back teeth a little bit easier. So
Okay.
That's
I'm in
the
the
one I
market
like.
for a new toothbrush. That's why I
there you
asked.
go, and you can get their replacement head on Amazon. It's easy.
Speaking of, Shanina's had a question she's wanted to ask you for, I think, months now.
What? No, don't ask.
Go
I know where
on.
she's at.
Go
Is it the
on.
question?
Yeah, it's the question. Go and do it. Do it.
No.
She wants to know.
The fact I was like, she knows me quite well. I was like, you're not going to bring this up.
100% I'm going to read.
Okay, everybody.
She's turning different colors just saying the question.
I know. So I don't know when I called you about this, and it was a random thing, and I probably saw it on Instagram. And I told Georgia, and I'm going to ask you, can you tell the difference? Can you tell when a patient has come in and
Has
performed
had
oral sex?
Ratio.
They say dentists can see that.
Yes.
Really?
Okay, hold on. Let me clarify.
Look at my
this.
feet. So
The way, how can I say?
This is amazing.
So the way we can tell is from the palate. So if there's changes in the palate, if there's like trauma to the palate,
It's trauma.
it is.
Well, there you go, guys, and that's it. That's
there
all we
you
have
go.
time for today.
So
it's
the next time,
trauma.
go, I'm not in the mood for trauma. Thank you so much.
Wait, do you have a little giggle to yourself? And you're like, yeah, I can see that.
So there's how's it? It's more flat or what?
No, there's just, you can see
Dent marks.
little,
No?
not, you can see little abrasions on the palate.
Whoa, really?
Oh no, I shouldn't say that.
You
Like,
are. Shanina's going to be abstaining before she comes to see you in the future, Dr. Ellie. That's for sure.
I don't want
No
trauma in my
naughty
mouth.
times.
I'm not at all staying. You should stay away from that. Please do as you.
So you don't see any little swimmers like hiding between the teeth or anything like that?
God, no. God, I hope not. Oh, no.
So
Sorry,
you
we had
can
to
tell that the abrasion, and it's like, I guess I think the fun fact was like you can tell within like the day or so that it's been happen.
Yeah.
Well, just to let you know, and that's the truth about your mouth.
I would never bring it up to anyone if I notice it, but yes.
Please do. Next time Shanina goes in there, if she happens to have had sexy time, like you make sure you tell her.
Excuse me.
You know.
What have you been up to? Shanina?
No, I am a lady of leisure. I don't want trauma in my mouth. Okay. Well, that is very interesting. And yes, that was the big question.
I knew you were going to ask that. I knew it.
I knew. It was just, it's very interesting.
It is. We all wanted to know that one. Sorry, I had to go there.
It is a very, like dentists really know your life looking in the mouth.
I told you.
It is. Like what you eat.
That's why you tell me all your secrets is because I've been.
Yeah.
Is it like reading someone's palm or tea leaves or something? You can look in their mouth and go, I can see that you're going to have a very long life. And this line tells me.
But you know what? It's funny that you're saying that, but there is a lot of correlation between your oral health and your general health. It has a lot to do with it.
Tell us, please.
And that's why, that's why you hear you have to go to the dentist regularly. There's only so much you can do at home brushing and flossing your teeth. But plaque is going to build up. Bacteria is going to build up. And
Coffee stains.
stains are not going to affect your general health, but the bacteria in your mouth can affect your heart. It can affect your blood. It can affect your pregnancy. It can affect.
It can affect your pregnancy.
Of
as
course,
well, huh?
yeah. If
Wow.
you have periodontal disease, if you have unchecked periodontal disease, you can go into early labor. Yeah, there's a whole. Georgia and I did something a little earlier a couple of years ago where we talked about men that have periodontal disease. They also have sexual dysfunction issues.
And there's nothing worse, I'm sorry, than like, I've been on a couple of dates with guys where they've been great guys and they've checked every box.
And they go,
And then they're like,
Georgia.
and you're like, well, it was really nice to meet you. And they can be the greatest guy, and yet, like, even years later, even if they fix their periodontal disease, I'm still like, oh, get it out of my
You were traumatized.
head or my nose. Or, it's trauma.
It is.
Dude,
It is.
It can be fixed though.
It can, but even then, like, it's like,
It
it's
can,
done.
but I mean, personally, I think the way maybe women, or I think maybe, I'll just talk about myself. It just shows me that they're not taking care of themselves.
Yes, and that extends to everywhere else.
Yeah.
Yeah, I agree.
You want a clean guy.
You do want a clean guy.
Or a
Take
clean
note,
girl.
man.
Yes.
It's very important to us.
it
You also
is.
want a clean girl, though, to be fair.
And girls
Yeah.
too,
Yeah,
of
yeah.
course.
There's a lot of messy girls out there.
You just don't realize, like, going to the dentist, like, yeah, sure, it's for my teeth, but there's so many correlations to how it affects your health with so many other things
100%.
internally. I wouldn't have known that.
100%.
Do you think taking care of our teeth has extended our lifespan over the years? Because, I mean, back in the day, people died at 40. Probably had a lot to do with their teeth.
It did. Imagine if they had infections in their mouths.
Yeah.
Like, where does that infection go? It goes into your bloodstream.
Yeah.
There's, our mouths bleed.
Yeah.
People that have had some sort of surgery or they have artificial joints, why do we need to pre-medicate them with antibiotics when they're coming into the dentist? Because we are introducing bacteria into their bloodstream
Right.
by cleaning their teeth or doing, crown preparation or extracting a tooth. Our mouth is full of bacteria.
Yeah.
Yeah.
Yummy. I'll think about that next time I'm making out with someone. Want to swap bacteria?
It's true. Well, yeah.
You gotta be very careful who you swap bacteria with.
You do.
Just hope they take care of their.
Yeah, absolutely.
Ask who their dentist is.
Yeah. I have to know. Give us some horror stories.
Yeah, I
What are
was
some of the
going to ask that.
worst? Yeah, we want to know.
Give me, 2 horror dentist stories.
The first one that comes to mind is when I was in dental school. So I went to USC for dental school, and once we were able to see patients, we had to do certain rotations, and our rotation was at the county hospital, and we had to see the inmates that they were bringing in. So
Can't imagine they get regular cleanings.
no,
Yeah.
they don't get regular cleanings.
No.
But what I saw was like beyond the regular cleaning.
Wow.
I wish he just needed a cleaning.
Wow.
This gentleman came in and he had an infection, and when I did his examination, there was like all these things growing in his mouth.
What do you mean?
And so he had sexually transmitted disease that was in the oral cavity and had become ulcerations. It was
God. What, like a herpes or something?
I don't think it was herpes. I think it was like syphilis or something like that. I don't remember.
Doesn't that go into your brain?
But it was
Yeah.
it was horrific. The way it looked, the way it smelled, like, and here I am. I'm like this little 20-some-year-old.
Oh my God.
It was traumatizing. So that to me was one of the worst things I've ever seen.
Growing in the mouth,
How do you even treat something like that? Like, what do you do?
I mean, we weren't really able to do much for him.
really?
Really weren't able to do much for him. Yeah.
Wow. But what would you do now as a dentist with a lot of experience? Would you just pull all the teeth, or?
Yeah, you need to pull all the teeth. You
Yeah.
need to put them on, medication. You know,
Dentures. That's about it.
I mean, if it's affected their teeth, like, obviously, yeah. But his was mostly like soft tissue. He just had all these gross ulcerations all over his gums and his palate. And
How could he even eat?
Poor guy. I don't know.
Yeah.
I don't know. I think he was just being abused in jail. Probably it was
That's
terrible. Yeah.
God, that's really that's rough.
So that's one horror story. I'm trying to think like that, but this was. I mean, I've been out of school way too long. I don't even want to say how long it's been. You'll be able to tell how old I am. But other than that, being in a private practice in Santa Monica, you don't really see a lot of gross things. Everybody is like,
Everybody looks after their teeth in Santa Monica.
I mean, for the most part, yeah, we get here and there. But I think mostly it's sometimes the way a patient acts. Those are like, to me, those are the bigger nightmares. Gross things don't faze me anymore.
Right.
Yeah.
It's just how somebody reacts to you or how they treat your staff or
How could anyone not be nice to you?
And your stuff and Pablo. It's all great energy.
You would be surprised.
What,
Really?
give us an example.
I think that's one of the challenges as a woman.
Right.
It definitely was a challenge when I was younger because I just looked younger than my age. For the first 10 years, nobody even, thought I was the doctor. They all thought I was the nurse. Are you the nurse? No, I'm not the nurse.
Yeah. Yeah.
Now being a business owner and now having the confidence that I have now because I have a lot of years of experience under me, I don't get those comments because I don't look that young anymore. But still, people come in and they think they can, be disrespectful or they can, push their way around. They can be rude to your staff, and I don't put up with it anymore.
Good.
I don't.
People need to learn manners. It's the same type of person that's rude to the waiter in the restaurant.
Yeah.
Literally the worst type of person.
Yeah, I get.
But honestly, I have really good patients. I'm very lucky. I have a great relationship with most of them, and if there's something that they don't like, we politely, part ways.
Yeah. Wow, I feel like I've learnt so much today. And I'm just so
much.
happy that we got to ask your question, Shanina, that you've been wanting to ask for months.
It's been on my mind for months.
Yeah, she really did want to know that. So thank you for answering that. I'm sure everybody at home is going to be like in the mirror the day they go to the dentist. Am I going to get found out?
No, I always love hanging out with you guys. We were, before this, we were talking about how it's so nice to be surrounded by a group of women that are so capable. And I think I said this to you the first time I met you.
You
when
did.
you were telling me. And I've actually discussed this with other people. I see so many people throughout the day, right? And I can say that in the last few years of being, coming across so many people, my female patients are just killing it. Honestly, it feels so good. And you are all so accomplished. You're so independent. You're, so thoughtful. And I can't say that about all of the guys. So I really feel so proud of everything that we've all done. I feel very accomplished too.
You've moved into a new journey of what you love as well with injectables and just expanding.
And creating.
You're very good at content.
Thank you.
You're
Oh,
very,
great
very
at it.
good.
that was so hard.
We learned so. I learn, and like you can see, Georgia learns so much as
Oh,
well.
I'm
Yeah.
I always think, do people actually listen to my?
Oh yeah.
Yeah, they do.
No, they
We
do. Yeah, and you know what? Good on you for stepping through that fear and actually doing it, because we've talked about this a lot on the podcast. It really is hard to put yourself out there.
You and I talked about it in the beginning. Remember?
Yeah, but it's so like actually taking that step to make that content is not only time consuming, and you have to really dive in and be creative. It's really scary.
It is scary. It is scary. I mean, I'm just embarking on. I was speaking with Shanina about this. I'm also coming out with a line of medical sets. I mean, they're like scrubs, but they're not really. They can be worn out. They don't have to be scrubs.
Wait, sexy scrubs?
They are sexy. They have a cute zipper. They have really cute
really?
detail on them, and that was stepping outside of my comfort zone. I didn't know anything about design. I didn't know anything about production.
Yeah, but you always look fabulous, so this doesn't surprise me at all.
You're sweet. You're sweet. But
true.
I said when we were redoing the office, I'm like, God, I can't deal with these fig scrubs anymore. Like we need something cuter.
Yeah.
I want something made for the girls, and this idea kind of evolved. It's taken a long time, and this is one of the things that somebody that is not. I've never been involved in production of something. I never realized it took so long, but so many samples, so many revisions. But we're like, we're there. We're about to go into production. So that's the next kind of scary thing for me, but I'm really excited about it.
Gosh, you are entrepreneurial.
Yeah. Where can nurses and
So we're
get these scrubs?
It's going to be all sold online. The name of our brand is called Code Gallery, or Code.
Can you spell it?
Code, and it has an accent above the E.
Yeah.
Amazing. Code Day Gallery.
Yes.
And where else can people find you in person and online?
So on Instagram, I'm at Dr. Ellie DDS. My website is santamonicadentalaoffice.com.
Amazing.
My TikTok is Dr. Ellie DDS, kind of like fun things on
She's
there
a TikToker.
Definitely go in, visit Dr. Ellie and
Thank
the staff and Pablo. You feel at home. And
I mean, we
comfortable.
love Dr. Ellie, but definitely go see Pablo.
Definitely. I don't blame you guys.
No.
Don't blame you.
Thank you for coming on.
Thank you.
talking.
Thank you for
Appreciate
asking me. It's always such a pleasure to hang out with the two of you.
Absolutely.
You too.
Thank you.
Thank you.
Thanks, Dr. Ellie.
Thank you.